Hi, I am Ashley. I will give you guys some tips about personal paranoid disorder, anorexia, short-term, long-term memory loss causes, symptoms, treatment, home remedies, and prevention, swine flu and computer vision syndrome causes, symptoms, and treatment. Did you know that around 10% of individuals globally suffer from a personality disorder? Paranoid personality disorder, PPD, is a type of personality disorder that can cause the individual to develop unreasonable suspicion of others. If you observe an individual being constantly suspicious in relationships or hypersensitive to criticism, there is a high probability that he or she could have PPD. To know more about this disorder and how to manage it, watch this video. What is paranoid personality disorder? Symptoms of paranoid personality disorder. What causes paranoid personality disorder? How to diagnose paranoid personality disorder. How to treat paranoid personality disorder. What are the complications of paranoid personality disorder? What is paranoid personality disorder? Paranoid personality disorder, PPD, is a type of personality disorder that causes the affected person to behave oddly or eccentrically. This disorder falls under a group of personality disorders called Cluster A. Individuals who have PPD usually also have paranoia. This may lead to unrelenting mistrust and suspicion of others even when there is no reason to do so. Another hallmark of this disorder is being reluctant to confide in others and bearing grudges. PPD usually surfaces by early adulthood and is more common in men than in women. The main signs and symptoms associated with paranoid personality disorder are discussed below. Symptoms of paranoid personality disorder. Individuals with PPD are constantly on guard as they believe that others out there are trying to demean, threaten, or harm them. Such unfounded beliefs can interfere with the affected person's ability to form close relationships. The symptoms exhibited by a person who has PPD are believing that others are trying to harm or demean them, doubting the loyalty, commitment, or trustworthiness of others, reluctance in confiding in others, being hypersensitive when it comes to criticism, getting angry or hostile quickly, recurring suspicions when it comes to their spouse or partner without reason, being cold and distant in relationships, difficulty in relaxing. These are some common traits seen in those who have PPD. Let's now look at the factors responsible for triggering paranoid personality disorder. What causes paranoid personality disorder? While the exact cause of PPD is not yet found, it is believed to be triggered by a combination of biological, environmental, and psychological factors. Paranoid personality disorder is often seen in individuals who have close family members with a history of schizophrenia and other delusional disorders. Emotional or physical trauma during early childhood is another contributing factor to the development of PPD. If you think that you or someone close to you are exhibiting symptoms of paranoid personality disorder, it is best to see a doctor. How to diagnose paranoid personality disorder. Once you visit a doctor, they may begin by asking you questions about the symptoms you exhibit and your family and medical history. They might carry out a physical examination to look for any other possible conditions you may be affected with. If the examination or the symptoms you exhibit indicate PPD, you will be sent to a psychologist, a psychiatrist, or a mental health care provider for further testing. The mental health care provider will do a comprehensive or detailed assessment that may include asking you about your childhood, work, school, and relationships. You may also be asked how you deal with or respond to an imaginary situation. They gauge your reaction to various situations and then make a diagnosis. If you are found to have paranoid personality disorder, your doctor will discuss and create a treatment plan for you. How to treat paranoid personality disorder? The main drawback of treating PPD is that most affected individuals have difficulty in accepting treatment. However, in general, treatment for this disorder can be very successful. Individuals who are willing to go ahead with treatment for PPD can avail talk therapy or psychotherapy. These therapies aim at helping the individual cope with the disorder, teaching how to communicate with others in social situations, helping to reduce the feelings of paranoia. Certain medications can also help in the treatment of paranoid personality disorder. Some medications work especially well if the patient has other related conditions like depression and anxiety disorder. Such medications include benzodiazepines, antidepressants, antipsychotics. Combining these medications with talk therapy or psychotherapy can help in managing PPD successfully. It is important to avail treatment for paranoid personality disorder to avoid the complications discussed below. What are the complications of paranoid personality disorder? People with this disorder live less functional lives. The unusual and suspicious behavior associated with PPD can interfere with the affected individual's relationships, as well as their ability to function socially and at work. You must know that there is no cure or prevention for paranoid personality disorder. Treatment aims at improving the symptoms, and affected individuals may have to continue with the treatment throughout their lives. PPD causes a lot of emotional turmoil. Hence, support and care have a great role to play in managing its symptoms. I hope you found this post helpful. Experts' answers for readers' questions. What part of the brain is damaged when someone has paranoid personality disorder? Paranoid personality disorder is more of a problem with belief than the damage of the brain. Is paranoid personality disorder similar to schizophrenia? Paranoid personality disorder was initially associated with schizophrenia due to the similarities in symptoms like suspiciousness and paranoid delusions. However, the evidence for such an association is not strong enough. What are the 10 personality disorders? The 10 types of personality disorders are paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder, antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder, avoidant or anxious personality disorder, dependent personality disorder, obsessive compulsive personality disorder. Our second subject is how to deal with anorexia. The prevalence of anorexia nervosa in Western countries is 0.1% to 5.7% in females, Worldwide, the prevalence of this eating disorder is 0.3% in young women, and it is more than twice as common in teenage girls. While the average age of onset of anorexia is 15 years, 80% to 90% of the affected individuals are females. If you know someone who eats very less, skips meals often, purrs in secret right after a meal, or has lost a significant amount of weight in a very short period, chances are that they could be anorexic. This video is especially for those who are suffering from anorexia or know of others suffering from this eating disorder. Keep watching or reading to know the available treatment options for anorexia. What is anorexia nervosa? Signs and symptoms. Causes and risk factors. Dieting beside anorexia. Diagnosis. Available treatment options. How to deal with anorexia. Tips to manage anorexia. What is anorexia nervosa? Anorexia nervosa, also referred to as anorexia, is an eating disorder. It is characterized by abnormally low body weight and an intense fear of weight gain. These feelings may further be accompanied by a distorted perception revolving around weight. Individuals affected by anorexia severely restrict the amount of food they eat. This could be either to continue with their weight loss or to prevent gaining any extra kilos. In some cases, the individuals may also control their calorie intake by vomiting post-eating, exercising intensively, or misusing laxatives for this purpose. While anorexia is not a mental health disorder, some individuals may develop this life-threatening behavior as a way to cope with emotional problems. It can also affect pregnancies. Those still battling anorexia may exhibit deterioration in their symptoms, whereas those who had been treated may have a remission. Those who had mild symptoms tend to have uncomplicated pregnancies. The signs and symptoms of anorexia can be associated with starvation and can also be a result of emotional and behavioral issues. Signs and symptoms. Physical symptoms. Extreme weight loss. Thin body. Abnormal blood count. Insomnia. Feeling of dizziness and fatigue. Fingers turning bluish. Thinning and increased damage to hair. Absence of periods or menstruation. Abdominal pain. Skin turns dry or yellowish. Constipation. Intolerance to cold. Irregularity in heart rhythm. Drop in blood pressure. Dehydration. Arms and legs may turn swollen. Teeth may be eroded due to induced vomiting. Some individuals affected by anorexia may binge, eat, and purge like those affected by bulimia. However, the former lot is usually underweight, whereas the latter lot is often normal to overweight. The emotional and behavioral symptoms of anorexia nervosa may include emotional and behavioral symptoms. Attempting to lose weight by restricting food intake severely by dieting or fasting, exercising excessively, binge eating followed by self-induced vomiting. Other symptoms are frequent skipping of meals, eating only certain foods low in fat and or calories, not eating in public, checking one's weight repeatedly, lying about the amount of food that has been eaten, reduced libido, frequently complaining of being fat, lack of interest, insomnia. While the exact cause of this eating disorder is not known, The following are some of the most common factors that may be involved in triggering anorexia. Anorexia may be triggered by a combination of biological, psychological, and environmental factors. Biological, some genes could be involved in causing anorexia. Psychological, those with an obsessive-compulsive personality trait or anxiety might be more likely to develop this condition than the others. Environmental, peer pressure, and one's surrounding culture that associates beauty with thinness and also further fuel the condition. Some factors may also increase your risk of developing anorexia. They include a family history of the condition. Dieting or starving yourself can make it difficult to develop normal eating habits. Age, it is more common in teenage girls and women, but boys and men can also be at risk. Emotional stress and/or anxiety. Some of you may confuse anorexia with dieting. However, that should not be the case as both are completely different. The following are some of the major differences between the two. Dieting, anorexia. Anorexic individuals will restrict their diet to just a few hundred calories daily. Sudden weight loss, starvation, binge eating and purging, self-worth highly based on body shape and weight. However, dieting is usually aimed at getting a healthier body by consuming moderate amounts of healthy food without starving yourself. Dieting, those dieting will get all the necessary calories but from healthy foods. Healthy dieting does not involve crash dieting. Instead, a person will lose weight gradually and will not be underweight or starved. Dieting does not involve starving. It mainly aims at substituting unhealthy foods with healthy ones. The food eaten is not purged. Those dieting are most often than not hardly obsessed with their weight. They eat healthy to feel healthy. If you suspect that you or someone you know is suffering from anorexia, don't shy away from seeking help. Your doctor may carry out various tests and exams to pinpoint the cause of and your rule symptoms. Out other medical causes for weight loss. Such diagnostic tests usually include physical examination that may involve measuring your height, weight, heart rate, blood pressure, and other symptoms, and analysis of your family history. Laboratory tests like a complete blood count test, or other specialized blood tests to check your electrolytes, protein, as well as the functioning of your vital organs such as your liver, kidneys, and thyroid. Urinalysis. Psychological evaluation to evaluate your thoughts, eating habits, and feelings. Other tests like an X-ray or electrocardiogram to find your bone density, or heart irregularities, if any, in case your tests prove that you are suffering from anorexia. Your doctor may prescribe the following medical treatments to help you recover from the eating disorder successfully. Available treatment options. Some of the available treatment options for anorexia nervosa are hospitalization. If your condition is critical, you may have to be hospitalized immediately. This usually happens when there are issues with your heart rhythm, or you are dehydrated or suffer from severe malnutrition. Tube feeding and frequent monitoring your symptoms and vital signs, like your hydration levels and electrolytes, may need to be monitored frequently. In serious cases, patients may also need feeding via a tube. A healthy diet that is provided by a dietitian to help you get back to normal eating habits. Psychotherapy, family-based, group, and individual therapy that will help an individual to make healthy food choices. Medications. While there is no particular medication for anorexia, the affected individuals may be given antidepressants and psychiatric medications to treat other symptoms like depression and anxiety, who may provide diet. Following a healthy diet is very necessary to treat anorexia. However, since anorexia is a serious condition, do not self-medicate. Instead, consult a dietitian who may provide diet tips to help you get back to a normal eating pattern. How to deal with anorexia. When it comes to restoring the lose weight, anorexic individuals should follow a specific meal plan provided by a professional dietitian. However, some affected individuals could be at risk of the refeeding syndrome, where one's body may react negatively to a sudden increase in their food intake. In such a scenario, a medical team that consists of a doctor and a registered dietitian nutritionist should calculate, monitor, and increase the affected individual's food and fluid intake during the refeeding phase. For those who are not at risk of refeeding syndrome, it is not uncommon for their calorie needs to reach 3,000 to 5,000 calories daily. This is especially the case for affected adolescents who are still growing and young. Such individuals can safely start by eating 2,000 to 2,500 calories per day and increase their calorie intake to 3,000 to 5,000 daily calories. Your aim is to reach a diet where 50 to 60% of the total calories come from healthy carbohydrates, 50 to 20% from protein, and 30 to 40% from healthy fats. Healthy carbohydrates include vegetables, whole fruits, legumes, nuts, seeds, and whole grains. Protein-rich foods include seafood, dairy, eggs, oats, and soy. You can get healthy fats from avocados, dark chocolate, whole eggs, fatty fish, nuts, and olive oil. Here are a few tips to manage anorexia. Tips to manage anorexia. Stick to your treatment plan by not missing any therapy sessions and not skipping meals. Follow a healthy diet and get all the important nutrients that you lack. Do not isolate yourself from those who care. Instead, seek support from family and friends. Resist the urge to check your body weight or look in the mirror too frequently. Avoid fat or crash diets. Practice yoga to relieve symptoms of stress and anxiety. Work on the root of the issue. These basic tips can help your treatment plan work better and also reduce the chances of relapse to a great extent. Unfortunately, those suffering from eating disorders like anorexia tend to deny the need for treatment initially. This could be because they continue to fear weight gain. Hence, as friends and family, it is up to us to keep a close eye on such individuals, while also providing support and helping in their recovery. Hope this video addressed all your doubts and queries regarding anorexia. For any further questions, ping us in the comment box below. Experts' answers for readers' questions. How to be anorexic and exercise. Individuals affected by anorexia can exercise if they have already begun treatment successfully, as it will not interfere with their weight restoration. However, mild to moderate intensity exercises are recommended as compared to high-intensity workouts. When to see a doctor for anorexia. If the affected individual denies treatment, it is recommended that you coax them to talk to a doctor. Anorexia needs to be treated medically. What is the BMI for anorexia? Adults whose BMI is below 17.5 are anorexic. This BMI can further drop to 16 and 15 in those suffering from moderate to severe cases of anorexia. What happens if anorexia is not treated? If left untreated, anorexia can lead to starvation and malnutrition. In the long run, this can cause your bones to lose density and damage your kidneys and may even cause heart problems in some people. In rare and severe cases, it can also cause sudden death. How does anorexia start? Anorexia usually starts during puberty. It can cause one to restrict food to such an extent that he or she loses weight significantly. It is often caused by an intense fear of gaining weight. What is the difference between anorexia and bulimia? In the case of anorexia, individuals starve and lose 15% or more of their ideal body weight, whereas in the case of bulimia, individuals tend to binge eat and purge. Individuals affected by bulimia also often weigh normal or may even be slightly overweight. Let's talk about short-term memory loss, causes, symptoms, treatment, and prevention. What is short-term memory loss? Causes, symptoms, treatment, and prevention. You are about to leave the house when you realize that your car keys are missing. And no matter how much you try, you are unable to recollect where you kept them the other night. Or you forget why you walked into a room. Does any of this happen to you a lot? Memory loss is an inevitable part of aging. Chances are that you forget things that took place just a few hours back. The first thought that may come to your mind is that it could be Alzheimer's disease. However, not all cases of memory loss are a result of AD. To find out more about short-term memory loss, its causes, and treatment options, keep watching, please. What is short-term memory loss? Short-term, long-term memory loss. What causes short-term memory loss and forgetfulness? What are the symptoms of short-term memory loss? How to test short-term memory loss? Risk of short-term memory loss. Home remedies to help treat short-term memory loss. How to prevent short-term memory loss? What is short-term memory loss? Short-term memory loss is a condition in which the individual in question tends to forget things they saw, heard, or did recently. When your brain processes and stores small pieces of information that it has just taken in, it is referred to as short-term memory. While short-term memory loss is quite inevitable in the aging lot, it can also be triggered by a deeper issue like dementia, an injury to the brain, or a mental disorder. Before getting into the details, let us understand the difference between short-term and long-term memory loss. Short-term, long-term memory loss. The main differences between short and long-term memory loss are as follows. Short-term memory loss. The affected person ends up forgetting things that were done a short while back, etc., what they had for breakfast or watched the previous night. It is a part of normal aging. It could be a result of other underlying medical conditions like Alzheimer's disease. Its main symptom is forgetting recent activities or things. Long-term memory loss. The affected individual has trouble recalling memories when they need it. Such memories could be weeks, months, or even years old. Like short-term memory loss, long-term memory loss is also a part of aging. It can also be caused by underlying conditions like Alzheimer's disease. Its main symptoms is forgetting things that took place earlier in your life. Let's now look into the factors that are quite commonly held responsible for triggering short-term memory loss. What causes short-term memory loss and forgetfulness? The potential causes of short-term memory loss include advancing age. It is more common in older adults. Tumors in the brain, clotting of blood in the brain, injury to the head from a fall or accident such as a concussion, infections around or in the brain such as encephalitis, mental issues like anxiety or depression, substance abuse, some medicines like statins, anxiolytics, and drugs for seizures, medical conditions like post-traumatic stress disorder, Parkinson's disease, Huntington's disease, and Alzheimer's disease. Short-term memory loss is also often associated with the following symptoms. What are the symptoms of short-term memory loss? The symptoms of short-term memory loss may include asking similar questions repeatedly, forgetting where you kept a belonging, forgetting having participated in recent activities, forgetting something that you have recently seen or read. If you notice any of these symptoms, it is best to get an appointment with a doctor to get yourself diagnosed correctly. How to test short-term memory loss? Your doctor will start by asking questions about your symptoms. They may also want to know how long you have been experiencing these symptoms and about your medical history and lifestyle. A general physical examination may follow this. A blood test may also be ordered to test for other underlying conditions. To check if there is a physical cause to the memory loss, your doctor may also suggest an MRI or CT scan of your brain. Depending on what has been triggering the short-term memory loss, your doctor may then refer you to a specialist for further testing and treatment. It is better to diagnose the cause of short-term memory loss as soon as possible to prevent further complications from the condition. Risk of short-term memory loss. Most risks associated with short-term memory loss are a result of the underlying conditions responsible for triggering it rather than the memory loss alone. If the symptoms of short-term memory loss become too severe, it may interfere with your ability to drive, take care of yourself, avail treatment. We can conclude that individuals experiencing short-term memory loss must not be left alone, as it has the potential to become life-threatening. There is a range of medical treatments available to combat short-term memory loss. However, these treatments vary depending on the cause of the condition. Medications to treat clots, surgery, cancer therapy, and cognitive therapy are the most popular approaches when it comes to getting rid of memory loss caused by serious underlying medical conditions like cancer or blood clots in the brain. In some cases, nutrient deficiencies could also be responsible for triggering short-term memory loss. Restoring the deficient nutrient can help with memory loss. There are also a few natural remedies that are known to enhance your cognitive functions, which may also be beneficial in treating the symptoms of short-term memory loss. They are as follows. Home remedies to help treat short-term memory loss. Number 1. Ginkgo biloba. Things you will need: 1 cup of water, 1 to 2 teaspoons of ginkgo biloba tea leaves. How to do it? Add 1 to 2 teaspoons of ginkgo biloba tea leaves to a cup of water. Bring it to a boil in a saucepan and simmer for 5 minutes. Turn off the stove and allow the tea to cool a bit. Strain the tea and drink it up. How often you should do this? You may do this 1 to 2 times daily. Why this works? According to a study published in the journal Frontiers in Aging Neuroscience, ginkgo biloba extracts were found to improve cognitive function, as well as symptoms of mild cognitive impairment and dementia. Hence, it may also be beneficial for short-term memory loss. Number 2. Omega-3. Things you will need. Omega-3 supplements. How to do it: consume an omega-3 supplement daily. Consult a doctor to know the correct dosage of the supplement for you. How often you should do this? You may do this once daily. Why this works? Omega-3 supplements exhibit protective effects in cases of dementia and mild cognitive impairment. They can, therefore, also improve short-term memory loss in the affected individuals. Number 3. Vitamin B12. Things you will need. Vitamin B12 supplements. Consume a vitamin B12 supplement daily. Make sure you consult a doctor for correct dosage. How often you should do this? You may take this supplement daily for a prescribed period. Why this works? Vitamin B12 deficiencies are often associated with symptoms of memory loss in older adults. Thus, restoring this deficiency may help enhance cognitive function in the affected individuals. Number 4. Curcumin. Things you will need. 1 teaspoon of turmeric powder, 1 glass of hot milk. How to do it? Add a teaspoon of turmeric powder to a glass of hot milk and stir well. Drink the mixture. How often you should do this? You may do this once every night. Why this works? The main active component of turmeric is curcumin. Curcumin may help reduce or reverse the symptoms of memory impairment. Hence, this remedy is a great option for treating short-term memory loss. While these remedies work their magic, here are a few tips that may help prevent short-term memory loss. How to prevent short-term memory loss? Get enough sleep. Exercise regularly. Solve puzzles and do other activities that challenge your brain. Reduce distractions by eliminating clutter in your home. Create a to-do list and stick to schedules. Most often than not, short-term memory loss is part and parcel of aging and quite common. It usually does not create many issues in the affected individual, as it doesn't interfere with their ability to function independently. However, if your short-term memory loss is a result of an underlying medical issue, it is highly recommended that you avail medical treatment for your condition immediately for effective results. Do not wait to consult a doctor if you feel that this condition is interrupting your daily life. Was this post helpful? Tell us in the comment box below. Experts' answers for readers' questions. How to help someone with short-term memory loss. You can make it easier for someone with short-term memory loss by being flexible and patient, helping the affected individual remember details, by breaking down new activities into simpler steps, providing more verbal cues rather than asking questions, establishing a routine, writing important things down on a paper, not leaving them alone. Do memory problems always mean Alzheimer's disease? No, having a memory problem doesn't always mean that the individual has Alzheimer's disease. Aging, other underlying health problems, cognitive issues, or dementia could also be triggering the problems with memory. Is short-term memory loss serious? Most cases of short-term memory loss are a result of advancing age and are thus not so serious. However, if underlying conditions like dementia or an injury to the brain is the cause of the memory issue, it may lead to further complications if treatment is not availed on time. Can stress and anxiety cause forgetfulness? Yes, mental disorders like stress, depression, and anxiety can trigger for forgetfulness, difficulty in concentrating, confusion, and other cognitive problems. When to see a doctor for short-term memory loss? See a doctor if the progressing short-term memory loss concerns you, and if you want to avail treatment for it. This is especially if the symptoms end up interfering with your day-to-day life, or if you exhibit additional symptoms that be an indication of some underlying medical condition. Swine flu, H1N1 flu, symptoms, causes, and treatments. During the 2009 pandemic of swine flu, 43 to 89 million cases of the infection were reported. Around 1,799 deaths were also reported in 178 countries during the one-year span. Yes, swine flu had taken all of us by surprise that year. Post the pandemic, some people stopped eating pork, and if reports are to be believed, many turned vegans. How does swine flu spread? What are the treatment and prevention options available to battle this infection? Watch this for more information. What is swine flu? Symptoms of swine flu. What causes swine flu? Risk factors. How to test for swine flu. Swine flu treatment. How to reveal swine flu symptoms naturally. How to prevent a swine flu infection. Healthy foods that help swine flu. What is swine flu? Swine flu is a type of viral infection initially observed in pigs, which is how it got its name. Pigs can also transmit the influenza virus to humans, especially to those who are in contact with veterinarians and hog farmers. Although this virus originated in pigs, it is primarily known to spread from person to person. Swine flu is also referred to as H1N1 flu, named after the virus responsible for triggering it. It can cause upper and potentially lower respiratory infections. The H1N1 virus strain was recognized by scientists in 2009. The virus was found to be a combination of viruses from pigs, birds, and humans. It is highly contagious and can quickly spread from one person to another. The symptoms associated with swine flu are more or less similar to those exhibited by regular cases of influenza. Symptoms of swine flu. The common signs and symptoms of swine flu include fever, chills, a sore throat, cough, runny nose, headache, fatigue, body aches, a runny nose, vomiting, nausea, diarrhea. Since the symptoms of swine flu are very much similar to that of the flu, it may be confused for the latter. However, the causes of both these infections differ as they are caused by different strains of the influenza virus. What causes swine flu? Swine flu is caused by a strain of the influenza virus called H1N1, which was previously only known to infect pigs. Unlike typhus, which is often transmitted by lice and ticks, the virus spreads more from person to person rather than from an animal to person. Since swine flu is very contagious, it can easily spread from one infected individual to another through the saliva and mucus particles. An infected individual can spread the virus by coughing, sneezing, touching utensils after touching the nose and eyes, When a non-infected individual touches the contaminated utensils and then ends up touching their eyes or nose with the same hand, they can also get infected with the virus. Some factors can also increase your risk of developing swine flu. Risk factors. Factors that are known to increase your risk of developing swine flu include age. Adults older than 55 years and children under 5 years are at higher risk of developing swine flu. Young adults as well as children who have been receiving long-term aspirin therapy. Individuals with a weak immune system, such as those with HIV or AIDS. Pregnancy. Pregnant women are also at a higher risk of getting the flu. Medical conditions like heart disease, asthma, or diabetes. If you think you may have contracted swine flu, it is better to get yourself diagnosed at the earliest to begin treating the infection promptly. How to test for swine flu? Your doctor may first carry out a physical examination and then ask you about your signs and symptoms. If swine flu is suspected, they may ask you to undergo a test to detect influenza virus. One of the most commonly used diagnostic tests to detect the influenza virus is the rapid influenza diagnostic test. For this, a swab sample from your nose or the back of your throat is collected. This sample is then tested for antigens that indicate the presence of the virus strain. However, since the test results are known to vary greatly, your doctor may diagnose influenza looking at the symptoms despite the test results being negative. If you are diagnosed with swine flu, the following treatments may be prescribed by your doctor to try and battle the infection. Swine flu treatment. Treatment is usually aimed at relieving the symptoms of swine flu. Medical treatments for swine flu may include taking any 4 of the FDA-approved antiviral drugs like Rapivab, Tamiflu, Baloxavir, Relenza. However, viruses can develop resistance to these drugs. Hence, physicians usually reserve these drugs for those at high risk of complications from the flu. Swine flu vaccines are also available to prevent the infection. If you exhibit mild to moderate symptoms of swine flu, in addition to medication, you can try the following tips to manage the symptoms naturally. How to relieve swine flu symptoms naturally. Rest. Getting plenty of rest can strengthen your immune system to fight the infection. Stay hydrated. Drink plenty of fluids and water to prevent dehydration. Soups are a great way to replenish your body with the lost nutrients. Painkillers. Try taking over-the-counter painkillers like ibuprofen. The following are some tips that can help you avoid the infection while also preventing it from spreading. How to prevent a swine flu infection. Stay at home if you are infected until you recover completely. Wash your hands regularly. Use either soap and water or an alcohol-based hand sanitizers for this purpose. Use a tissue or a face mask if you are coughing or sneezing to prevent the infection from spreading. Infected individuals must avoid touching their nose, mouth, or eyes. Avoid crowds if you are at high risk of catching the flu. Refer risk factors. Your diet also plays an important role when it comes to battling swine flu successfully. The following are some diet tips that can help manage the symptoms. Healthy foods that help swine flu. You will feel dehydrated and weak if you have swine flu. Increasing the consumption of certain foods can help alleviate the symptoms of the flu. They are broth. A warm broth can help prevent dehydration while also relieving congestion. Garlic. Adding crushed garlic to your favorite salads and dishes can enhance your immunity, thereby helping your body fight the flu better. Yogurt. Its immune-enhancing properties can help fight the flu symptoms. Other foods that can help improve your immunity include citrus fruits, leafy greens, broccoli, and oatmeal. You also need to avoid certain foods if you have swine flu. They are alcohol, caffeine, hard-jacked food that may be tough on your throat, processed foods as they are poor in nutrients. While most symptoms of swine flu usually ease in a few days, it may take up to a week to get over the flu completely. Following the diet and prevention tips discussed in this article can help speed up your recovery from swine flu and also prevent the development of secondary infection. If your symptoms are severe, avail medical treatment immediately to prevent complications from the infection. Hope this article has helped in clearing all your doubts regarding swine flu. For any further queries, do not hesitate to get in touch with us through the comment section below. Experts answers for readers' questions. How long does swine flu last? The worst of the symptoms of swine flu usually last for about 5 days. However, it may further take 1 to 2 weeks to get over the flu completely. Is there a vaccine for swine flu? Yes, there are currently 2 brands of vaccines for swine flu: Pandemrix and Cellvepan. What is the difference between swine flu and bird flu? While both swine flu and bird flu are both caused by influenza viruses, they are caused by different strains. Swine flu is caused by the H1N1 strain, whereas bird flu is triggered by the H5N1 strain. The symptoms of both these infections are more or less similar to the common flu. Does swine flu spread by eating chicken? No, swine flu does not spread by eating chicken. Can H1N1 be cured without medicine? Yes, mild to moderate causes of swine flu with the least risk of complications can be easily cured with bed rest and intake of fluids. Does a flu shot protect against swine flu? No, a seasonal flu shot doesn't protect against swine flu. Can you get swine flu twice? Yes, you can get swine flu more than once, just like the seasonal flu. Computer vision syndrome: causes, symptoms, and treatment. The sense of sight is indeed a blessing, but we tend to neglect this gift and subject our eyes to a lot of stress and strain every day. We end up working every day for a good 8 to 9 hours in front of computer or laptop screens, only to return home and start playing games on our cell phones. And then there are the social media updates that have become part and parcel of most of our lives. Computer vision syndrome is a result of all such digital exposure that we put our eyes through. Globally, computer vision syndrome affects about 60 million people. If we continue straining our eyes without taking the basic precautions, it may inevitably lead to further eye complications. To know how to care for your eyes while using your computer and more, keep watching. What is computer vision syndrome? How the computers affect vision? What causes computer vision syndrome or digital eye strain? Signs and symptoms. How is computer vision syndrome diagnosed? How to treat CVS. Prevention tips. Proper body positioning while using a computer. What is computer vision syndrome? Computer vision syndrome is a term used to describe all eye or vision problems that occur as a result of prolonged computer use. It is also commonly referred to as digital eye strain. Researchers are of the opinion that around 50% to 90% of individuals who work at a computer screen exhibit at least a few symptoms. However, it is not only the working adults who are affected. Children who stare at tabs or computers for too long can also develop issues, especially if the lighting and their posture are far from ideal. You might be wondering how computers can affect your vision. Find out in the next section. How the computers affect vision. Computer vision syndrome, CVS, is kind of similar to carpal tunnel syndrome as well as other motion injuries you are likely to get at work. It is caused by the repetitive movement of your eyes in the same path for long durations. When you are constantly looking at the computer, your eyes have to focus and refocus constantly, time and again. They keep moving back and forth from the computer to other things you may have to read or write down in between. They also react to the changing images on the computer screens. While such jobs may look easy, they require a lot of effort from your eye muscles. Let's now take a look at the causes. What causes computer vision syndrome or digital eye strain? Some common causes of computer vision syndrome are not using your reading or anti-glare glasses regularly, advancing age, uncorrected vision etiologies, poor lighting, glare on your digital screens, improper posture or viewing distances. Those suffering from this syndrome exhibit the signs and symptoms listed below. Signs and symptoms. The common signs and symptoms associated with computer vision syndrome are blurred or double vision, eye fatigue, flutters, a burning sensation in the eyes, dry eyes may become red and watery, irritated eyes, headaches, back or neck pain. So, are there any tests that can help the doctor diagnose this condition? How is computer vision syndrome diagnosed? The ophthalmologist can help diagnose your condition by carrying out an eye examination. Special attention might be given to how your eyes work and respond to different distances from the computer screen. Your doctor may also question you about your symptoms and how much time you spend in front of the computer screen to confirm the diagnosis. Once diagnosed, you may be asked to make a few simple changes to your working style. The following are some of the widely accepted practices for treating computer vision syndrome. How to treat computer vision syndrome. Once you are diagnosed with computer vision syndrome, it is very important that you visit your ophthalmologist for regular checkups to prevent your eyesight from deteriorating further. Medical prescriptions may include glasses or contact lenses as per your requirement. You may be given a regular pair of glasses to wear while looking at the screen, or you may be asked to get a special pair. Single bifocal lenses or tinted lenses may also be prescribed to boost contrast while filtering out the glare. Some simple changes to your workspace that can help with computer vision syndrome are: change any lighting that could be casting a glare on your computer screen. You can also reposition your computer if the light from a nearby window is the cause. Install a dimmer switch on the overhead fixtures that could be casting a glare on your screen. Rearrange your desk to slightly below your eye level and 20 to 28 inches away from your face. Give your eyes a break by looking at least 20 feet away every 20 minutes for 20 seconds. This is called the 20-20-20 rule. Prevention tips. While you don't have to cut down on your screen time completely to prevent computer vision syndrome from resurfacing, a few changes to how you use them can make things easier on your eyes. Use an anti-glare screen filter or a matte screen filter on your computer, phone, as well as tablet screens. Follow the 20-20-20 rule. Take a break for, say, about 15 minutes after every 2 hours of using the screen continuously. If your eyes tend to feel dry often, use artificial tears to lubricate them. Place a humidifier in the room close to the screens to prevent your eyes from drying. Make sure the lighting of your surroundings is bright enough for your screens. If you are a contact lens user, wear your glasses and give your lens a break while using the computer screen. Get your eyes checked by an eye care specialist regularly. Follow a healthy diet that is rich in various vitamins and minerals. Practice eye exercises like blinking slowly, rotating your eyes in the clockwise direction, or simply looking far away for a few seconds every now and then. The way you sit in front of your screen and the distance at which you sit from it also play a significant role when it comes to treating computer vision syndrome. Proper body positioning while using a computer. Sit close to the keyboard and position it right in front of your body. Adjust your keyboard level in such a way that your shoulders are relaxed and your wrists and hands are parallel to the keyboard. Wrist rest can help. Sit at an arm's length from the computer screen. Position the screen slightly below your eye level. The center of the screen should at least be 10 to 15 degrees below your eye level. Take small breaks every 1 to 2 hours. Do not use the digital screens during your break. It is very easy to neglect the misery you put your eyes through in your busy day-to-day life. However, a little care and a few tweaks to your lifestyle can go a long way in promoting healthy eyes. Do you have any more queries regarding this syndrome? Don't hesitate to ask us in the comments box below. Experts' answers for readers' questions. How long does it take for computer vision syndrome to go away? Computer vision syndrome is a temporary condition that may last from a few minutes to a few days. If left unattended, it can cause further damage to your eyes. Is computer vision syndrome permanent? Computer vision syndrome does not have any long-term effects and is usually a temporary condition. How can I relax my eyes from stress? To relax your eyes from constant stress, blink them every 20 minutes and look far away. You can also try placing the base of your palms on your eyes for a few seconds.